oftentimes when patients come in and they have back pain, they're trying to figure out what caused it. How did it start? I'm Dr. Jen Anaker with Anaker Clinics of Chiropractic. Certainly there are many reasons that create back pain. I mean, I always kind of joke with my patients to be able to come across and to understand that at no point in your life do you get a new body. So things can happen way into your early years, but here are certainly some things that you can think about on a day-to-day that might be causing you to have back pain. Number one is the lack of exercise. Our body needs movement as a nutrient, and we sit a lot. We have a lot of sedentary lifestyles, a lot of sitting at desks. Maybe you commute on a drive, you go home and you're watching a TV program, and so there's a lot of sitting that goes on. So getting up, moving around, doing some cardio, raising your heart rate a little bit, that can be so great for your body, and again, kind of counteracts any other time when you're sitting a lot. The phone. So the phone, if it's, if you're at an office and you're doing, head to the side, that can put a lot of stress on the neck. Certainly, most people have cell phones where we're going forward or in flexion, and, people are on their phones for hours a day, hours a week. That puts a lot of stress on the neck, and even with that head coming forward, that puts even more stress on the neck as you're going into that, into the forward position. So to go back to sitting a lot of people sit at a desk, and so take a look at the office chair. Is it comfortable? Does it give you support? Again, in that sedentary aspect, are you getting up? I love every 20 minutes, but at least every 45 minutes. Get up and walk around, move to go grab something. If you've got to go talk to another coworker, just figuring out some ways to get some movement throughout the day. Again, so you're not sitting in that sedentary chair. The next one is taking a look at your shoe quality. Oftentimes, we keep shoes long past, they've expired long past when we're still wearing them. Is that shoe giving you good comfort? For me, I'm on my feet all the time, and so I have a couple of different pairs of dress shoes. I need them to be really comfortable when I'm on my feet, and every 6 months, but no longer than 9 months, I'm back in the market for buying new shoes. So making sure that you have good supportive shoes. The next one is a mattress. Making sure that, the mattress isn't too soft, you're sinking in. If you're in the market for a new mattress, making sure that it's more firm. And there's a lot of different quality of mattresses. I tell people if they buy a mattress on the cheaper end, maybe think about, 5 years out, how is that mattress working? Higher quality, maybe 7 or just a little bit more years. But if you've made it to 10 years, you're probably pushing your luck. Mattresses just are not built to last much over a decade. So again, making sure if you're in the market for a mattress that it's firm. Well, that might not be the only thing. I have had a lot of patients that we've been working with, and all of a sudden they go out and get a new mattress, and it really takes their care to the next level because they're getting that good quality support. The last one is looking at what are you carrying on your shoulders. Maybe you have a messenger bag that's off to one side. Maybe you have a purse that's tilting your shoulder. Even if, you or your child has a backpack, are things balanced? Are things lightened up? That purse is classic for a woman where it's a heavy purse weighing them down. Go through that purse, take inventory. What do you need? What do you not need? Lightening your load, making things as even as possible. These are some causes of low back pain and neck pain, mid-back pain, some things to think about as you go throughout your daily course of life.